Hi, this episode of our health talk features the most dangerous infections a pregnant woman can have, and these infections can cause serious damage to the baby. Juliana Ome is the name. Touch infections is the topic. Touch is an acronym that stands for Toxoplasmosis, other infections like Varicella Zoster virus, Syphilis, and Parvovirus B19, Rubella, Cytomegalovirus, and Herpes Simplex virus. Touch infections are diseases caused by different germs, and they are common in pregnancy. These germs can either be virus, bacteria, or protozoa. These infections are first in the mother's body before they can affect the baby. This means that a woman can only transfer the infections to her baby if she has the infections. And a woman can become infected before pregnancy or during pregnancy. So when these infections are present in the pregnant woman's body, they can get to the baby inside the womb through the placenta or as baby passes through the vagina during childbirth. Now, these infections have some things in common. Most times, the mother will be infected, and yet it does not cause any serious problem for her, but at the same time, it can be dangerous to the baby. They can make a baby look deformed at birth, or even cause miscarriage for a woman in early pregnancy. Now, when a mother contracts any of these touch infections during pregnancy, it is called primary infection. But if she was previously infected and it manifests during pregnancy, it is called reactivation of infection. And now, primary infection is more likely to cause deformity for a baby than when there's reactivation of infection. Most of these infections are more dangerous to the baby in the first 3 months of pregnancy. And for the purpose of this health talk, we shall make emphasis on how a mother may get these infections and how to prevent them from happening. Now let's do this together. So touch is the acronym. T stands for Toxoplasmosis. Toxoplasmosis is caused by protozoa Toxoplasma gondii. One can get infected by touching the feces of infected cats, by eating raw or undercooked meats that contain this germ. Sometimes drinking water can contain this germ, and if one drinks the water without proper filtration, it can cause this infection. Also, by consuming goat's milk that was not properly processed, what is referred to as unpasteurized goat's milk. Toxoplasmosis is an uncommon infection, and if someone gets infected once, the person is protected for life. That means it confers a lifelong immunity. If a mother was infected with toxoplasmosis before pregnancy and her immune system is functioning well, her baby may not have this infection throughout pregnancy. But when a mother is infected during pregnancy, her baby can easily become infected. This is the primary infection we talked about. And the higher the age of the pregnancy at the time of infection, the more the likelihood of a baby getting infected, such that if a pregnant woman gets infected in the last 3 months of pregnancy, the risk of infecting her baby is as high as 60%. But when toxoplasmosis is diagnosed during pregnancy and is treated, the risk of infecting the baby reduces. So when a baby is affected by toxoplasmosis, the following may be noticed. 1. Chororetinitis. This means inflammation of the middle and the inner layers of the eyes. Intracranial calcifications. Hydrocephalus. When the head has too much water, baby may stop growing well inside the womb. Then if the head is not so big, baby may come down with what we call severe microcephaly, very small head. Now, prevention of toxoplasmosis will include 1. Avoid contacts with cats and cats' feces. Please avoid stray cats. Number 2, maintain good personal and environmental hygiene. Don't allow cats in children's play areas, because if these cats are infected, they can pass feces in there, and that way one is exposed to this germ. Number 3, make sure you eat well cooked meat and pasteurized goat's milk. Number 4, if you're pregnant, please don't empty the cat's litter where the cats pass feces. Even if you rear cats or you have a pet in your house, please avoid cats during pregnancy, because you may never be sure if the cat is infected or not. O stands for other infections, and the first of them is Varicella Zoster virus. It is also called chickenpox. It is caused by Varicella zoster virus. One can get infected with chickenpox by direct contact with someone suffering from chickenpox, or when you come in contact with respiratory droplets of someone that's suffering from chickenpox. Note that someone with chickenpox can infect another person for 8 hours before the rash appears, until the rash is burst open, and this can take 7 days. So within this period, the person is highly infectious. Once a person is infected with chickenpox, the virus remains in the body throughout life in an inactive form, which can become activated at any point in time, and the person will come down with the disease. Because after primary infection, the virus stays in the dorsal nerve root and remains there in dormant form throughout life. The risk of infection of varicella zoster is highest when a woman contacts this varicella infection 5 days before labor and 2 days after delivery. So as a pregnant woman, once you notice that you've been exposed to someone that has chickenpox, please inform your doctor immediately, because there's a special injection that will be given to you to protect you and your baby, and also the baby also receives this injection after delivery. This is very important, please, because babies are severely affected by chickenpox, and since it can be prevented, please present yourself to the doctor so that you can take advantage of this particular healthcare remedy. Now, for babies that have varicella, they come down with chickenpox blisters on their skin, and this can be prevented by the use of live vaccine for the mother before she becomes pregnant. It should not be used during pregnancy, please. If you are pregnant already and you come in contact with someone that has chickenpox, go to the doctor for that injection we've talked about, and not the vaccine, please. You should take it long before you get pregnant. Next one is syphilis. Syphilis is caused by bacteria Treponema pallidum. One can get infected through sexual means, and the baby can get infected while inside the womb. The germ that causes syphilis easily crosses the placenta, and it can cause miscarriage, or the baby will be born dead. That's stillbirth. Most babies, when they are born, they appear normal, but within 2 months of life, baby will have features like rashes on the body, nasal secretions, snuffles. These secretions you see are full of germs. Don't let them touch you. Then later manifestation of congenital syphilis will include bone and teeth deformities, such as saddle nose. Now, the nasal bone, the nasal septum has a bone, and if it's affected, it will give the nose a funny shape. There can be inflammation of the bone of the leg, inflammation of the joints, and the teeth will appear in a funny way. They will look notched and peg-shaped. It's called Hutchinson teeth. And so this infection is actually serious, and then the various features can show as the baby grows older, but this can be prevented. Now, syphilis is a sexually transmitted infection. There's no vaccine for now, so its prevention depends on safe sexual practices such as abstinence, use of condoms, identification and treatment of infectious cases. Routine antenatal screening for pregnant women for syphilis remains the most important factor for identifying babies at risk of congenital syphilis. So screening for all pregnant women in their first antenatal visits, and their women at higher risk are also screened a second time in the last 3 months of pregnancy. Some hospitals even repeat the screening at the time of delivery. Mothers, please, antenatal care is very important for you, so take it seriously, because once a mother is found to have syphilis, she's immediately treated and the baby is protected. Next one is Parvovirus B19. It is caused by Parvovirus B19, and the infection is common and it affects only human beings. One can get infected by contact with respiratory droplets of an infected person, transfusion of infected blood products, and note that parvovirus is common in younger children, and an adult can contact this virus from them. For example, people that work in daycare, children daycare. Once you feel that you've come in contact with a baby with parvovirus, please report to your doctor. Now, see how you know a child with parvovirus B19. A child with parvovirus B19 will have bright red rash on the cheek that will look as if he or she has been slapped. It is called red cheek syndrome. So a child with this appearance in school should be suspected to have parvovirus infection. Now, your baby is most affected if this infection comes between 3 and 6 months of pregnancy. And when this infection gets to the baby will have shortage of blood and gets swollen, and death can even occur. But if baby survives this shortage of blood, baby will be born normal. A pregnant woman with good immune system may not have serious infection from parvovirus. Now, how to prevent this from happening is to avoid contacts of respiratory droplets of patients with this infection. Now, R is rubella. Another name for rubella is German measles. It is caused by Rubella virus. One gets infected by contact with respiratory droplets of someone that has rubella, whether when the person coughs or sneezes. A woman that has rubella infection has an up to 90% chance of giving birth to a baby that has rubella syndrome, and the baby may not even survive. In the later half of pregnancy, this rubella virus does not have much effect on the baby, so what we worry about is early stage of the pregnancy. And once you recover from rubella, the body is protected for life. That's what we call lifelong immunity. But baby gets infected 5 to 7 days following maternal infection, and almost all the organs in the baby's body will be affected. And when the baby is growing, you notice that baby was born deaf. It's called congenital deafness. There's congenital heart disease. There's congenital cataract. The two eyes of the baby looks whitish. The lenses are covered by whitish material, and then this is called cataract. And so many things. A baby can be born dead. Now, the prevention of rubella is long before pregnancy by giving non-immune persons live attenuated rubella virus vaccine. And because it's a live vaccine, it should not be taken during pregnancy. It can affect your baby. You should take it long before pregnancy. And as an adult female, if you get vaccinated for rubella, please don't get pregnant immediately. The first time I saw a little baby with bilateral cataract, it was a woman that was pregnant, and she didn't know there was anything known as rubella infection, and that she could have been able to save her baby from having this kind of eye problem just by vaccination. She was very unhappy because an operation was to be done for her baby, and she felt her baby was too tender, and she wished she had protected herself before pregnancy. So please, knowledge is key. Information is key. Get to watch the health talk video we did on preconception care. I explained the things you ought to do as an adult female before you get pregnant. And again, if someone is already exposed to syphilis in pregnancy, you just go through proper counseling and then treatment will be done for you. The next infection is Cytomegalovirus. This is the most common viral infection that can affect a baby during pregnancy. It is caused by Cytomegalovirus. One can get infected by contact with saliva, urine, or other body fluids of an infected person. Then other means are through sexual contacts, and then organ transplantation of infected organs, and then through blood transfusion, but this is very rare. Baby can get infected through breast milk in addition to placental infection. Like other herpes infections, cytomegalovirus persists throughout life, and reactivation of infection can happen from time to time. But unlike rubella, cytomegalovirus can affect the baby throughout the stages of pregnancy, not only in the early stages. But the good thing is that most babies do not have serious problems when they are affected by cytomegalovirus. Only few babies suffer serious problem. However, cytomegalovirus is the commonest cause of congenital deafness, and baby can present with small birth weight. Baby can have rashes on the body, what we call petechial rash. Baby can have jaundice. Baby can have very small head or even very big head. So there are various ways a baby can present. But then now there's no vaccine for cytomegalovirus infection. So for the prevention, avoid unnecessary contact with people because anyone can be infected with this virus. Now the last one, Herpes Simplex virus. It is caused by Herpes Simplex virus, and one can get infected through sexual means. So it is a sexually transmitted infection. But for the baby, it is through direct contact with the mother's vagina during childbirth. Transplacental infection is not usual. That is, infection of a baby inside the womb during pregnancy is not common, except when a woman gets infected with herpes during pregnancy. But when this infection happens in early chance of pregnancy, there's increased chance of miscarriage. But if baby survives, the following can be seen. You can have rashes. Baby can have eye problem, chororetinitis. Baby can have small head or big head with water inside. Baby can suffer from seizures after birth. And baby can even die within 1 month of life. Now, how to prevent and save the baby from this is cesarean section. And then The truth of the matter is that herpes is actually common, and some mothers will shy away from CS, but CS is going to be helpful. Then for the mother, you have to avoid risky sexual behaviors. Before pregnancy, even during pregnancy, please practice safe sex. Now, touch infections are real, and babies suffer lots of damage from these infections. But with adequate knowledge on these infections, you can stay safe and have safe babies. And mothers, for you to know your status on these infections, go to the hospital, attend preconception care, and then when you're pregnant, take your antenatal care seriously. If you're listening to me and you're already pregnant, please don't sit at home. Start up with your antenatal care. Get checked and know how your body is, and if you have any infection, and know what to do and what not to do. You have everything to gain and nothing at all to lose from going to the hospital. So please, thank you for staying till the end of this particular health talk. Stay in touch so that I don't get touched by touch infections. Attached to the description box of this particular health talk is the link for preconception care. Do well to watch it and get to know all the things you should do before you get pregnant. Please, if you found this health talk valuable, do well to subscribe to this channel and click on the notification bell for subsequent uploads. You can drop your questions and your comments in the comment section below, and see you again. Thank you.